Courtney, would you share your story of navigating the children's mental health continuum and keeping in mind what that experience was like for you and how it could have been better or how it worked?
Absolutely. So I was a young single mother, just 20 years old. I knew that as a young single mother, I'd have many obstacles that I would have to endure over my life's journey. But fortunately for me, I had a very supportive family and a beautiful little girl to travel with me on this journey. The relationship between my daughter's father and I was very complicated and abusive. However, because this was my first real relationship, I did not understand why loving somebody was so hard. Unfortunately, my daughter witnessed many disconcerting events, which took a toll on her mental health. Over the years, her mental health deteriorated, and I did not realize all the capacities of help that were available for us, but ended up resorting to an extreme measure of inpatient treatment. They took my daughter from me with all the great intentions of helping her. They secluded her from me, and I was her only one safe person. We were unable to talk but once a day. I could only see her once a week, and all the calls and visits were monitored. She was broken. She was scared. And in her eyes, I abandoned her in the time that she needed me the most. I told the facility that after much deliberation of the situation, that I had decided that I did not want to continue services because it seemed her mental health was getting worse every time I talked to her and every time I saw her. She just wanted to be home and she just wanted to be in her safe place. The facility informed me that I could take her. That was my right. This was a voluntary placement. We brought her in by myself. I brought her in by myself. But if I did take her, it would be against medical advice. My insurance would deny her time there, and I would be responsible for the entire financial obligation, which was astronomical. Obviously, as a young single mother, only 20 years of age, this was not an option for me, and I had to leave her, which only intensified that feeling of abandonedness and that I couldn't be there for her during her extreme time of need. The good things that came out of this was that it gave her and I an ability to be referred to a therapist that she could talk to on a regular basis. And through the relationship with that therapist, she develops coping skills to work through her feelings that she was experiencing as opposed to just being sad all the time. They tried medication, but the medication just seemed to make it worse. And we weren't really on the page of medication. We just wanted to be able to have her understand what her feelings were, that they were valid, and that, it was okay to feel that way. It was human. What didn't work, I think, it was just placing my daughter in an unknown place with strangers, thinking that I was doing what was best for her, and learning that she was suffering more and not being able to bring her home. It was as though my opinions, my parenting skills, um, my love for my daughter would not help her, that only the medical intervention would, that they were the experts on all things related to my daughter. And I really felt helpless. I felt vulnerable and I felt extorted into keeping my daughter somewhere she did not want to be.
So, thank you for sharing that. And so, you have in prior positions, you have worked a lot with other families. Can you talk about how your story translates to them and the stories that you've heard, and if there are any overarching themes?
Yes, absolutely. So mental health is very stigmatized within the Indigenous population. Um, and there are many statistics that show how stigmatization is hurting our people, which creates a huge barrier because this stigmatization is often preventing someone that is suffering from mental health from seeking help. So, in addition to all the stigmas that are out there, the Indigenous people always don't always trust the government services due to historical trauma. Or in my case, there was a lack of cultural competence within the mental health department that just didn't work with our ways of life. Poverty also is a huge issue. Lack of insurance. There are many barriers to people who are seeking mental health services or could benefit from mental health services. Um, I mean, there's always been when I've worked with individuals at this capacity, um, it's always been an issue. Mental health has been a huge barrier for people, and they just don't know what it is or how to deal with it. Usually, in their situation, the mental health episode was immediate, and the mental health services are not always immediately available, which is scary because in the Indigenous society, we are 2.5 more times likely to suffer from a mental illness, and we have suicide rates that are 3 times higher than any other racial or ethnic group. I think one of the things that come to mind as far as like support that works for the Indigenous population is that, you know, we have a community that's supportive. We have families or people outside of our families that give us encouragement. You know, we have um, positive experiences that outweigh the negative experiences. You know, having someone to listen, someone to care, and most importantly, I think being trauma informed. When you're talking with Indigenous people, we're often private and do not want to share our life struggles with strangers. So having that solid support system has shared encouraging results within my community. I think that, you know, if I had to sum this all up, and what I would want people to know about mental health is that it's scary and it's unknown. And many times people don't know why they're sad or they're mad or they're overwhelmed. They just want to be normal. I think if we were just more understanding of those feelings, if we listened to those feelings and we validated those feelings and experiences, because those feelings and those experiences are their own. Everyone feels things differently. And the only way that we're going to move forward with healing is to be supportive, be understanding, be non-judgmental, and be trauma informed to every path that you cross, because everyone has a battle they're struggling with, and sometimes a smile can completely change somebody's life.
Thank you, Courtney. Thank you so much for sharing your story and then also sharing the stories of those that you have dealt with.